Hi, Dr. Monero. This is my elevator speech on the role of the NP. I love this assignment because I feel like I get asked these questions a lot, and now I have official definitions of what each role is. What is a nurse practitioner? Whenever I get asked this question, I always say the main difference between NPs and other mid-level providers or physicians is that we come from a nursing foundation. NPs can diagnose, treat, and manage caseloads. They're mid-level providers with prescribing authority, but again, they come from that nursing background. In Massachusetts, NPs are considered APRNs or CNPs. A huge monumental moment that happened in Massachusetts during COVID was that nurse practitioners can now work independently of physicians after 2 years of supervised experience. Any kind of movement like this is huge for the nurse practitioner profession as we try to expand our authority in all states. NPs work in specialty areas, hospitals, clinics, community settings like schools or shelters, and private practices. How does a nurse practitioner differ from a physician assistant? My sister and I have had this conversation a lot because she's a PA and I'm going to be an NP. But again, NPs come from nursing backgrounds. They all have an RN license. They have some sort of nursing degree, whether it's an associate's or a bachelor's, and then move on to get their master's or doctorate degree. PA programs are all master's level programs, so people have bachelor's degrees in anything. There's no requirement for that. My sister had a kinesiology degree, but she went to school with people who had liberal arts degrees. The legal scope of practice for NPs varies depending on the state. It also varies for PAs, but I feel that it's more standardized for them. PAs have no authority to work independently in any state, whereas NPs do in some. PA students partake in more clinical hours, 2,000 to be exact, whereas we're going to be partaking in 600 clinical hours at Regis. This is probably because PA students come from all sorts of backgrounds, whereas RNs already have a clinical background. Both NPs and PAs work in all areas, but you see NPs less in surgical settings, and you see more of them working in preventive care. You don't really see PAs working in primary care. How does a nurse practitioner differ from a physician? So NPs require 2 to 4 years of schooling. Medical doctors or doctors of osteopathy require 4 years of schooling. And if they specialize, they need to do a fellowship. They all have to do a residency program, and physicians really can be in school forever. I know one of my dermatologists was going to Florida for a third fellowship, even though he's been working in dermatology for many years. Physicians are considered practitioners of any area of medicine or surgery as long as it's been delineated by his or her training. They perform procedures, diagnostics, and surgeries, which you won't really see NPs doing, and certainly you won't see them do surgeries. NPs need physician approval or collaboration in order to prescribe in many states. And I always say that the main difference between NPs and physicians are different philosophies of thought, but I'll get into that in the next slide. Why don't you just become a physician? I hear this question from people of all walks of life, so I can't really attribute this to simply ignorance or, I don't get offended by this question, but I have been asked this a lot. Some people think from NP school I'm going to med school, and I'm like, no, it doesn't work that way. But personally, I think this is a big difference between NPs and physicians, we have always looked at patients as a whole. We've always had that holistic approach, and we just have a more intimate relationships with our patients in that way. And that's something I always appreciated about the nursing profession. There's also less schooling, and it's less demanding to become an NP than it is to become a physician. I can't imagine at the age of 31 that I would go to med school. So that's it. Thank you for watching.